Welcome to the Plastic Surgery Channel. Today we're going to discuss with some of our experts a recent paper came out stating that breast implants were in a sense dangerous because they caused other diseases such as cancers and other reproductive problems. Ashley, what do you think about this paper and this kind of approach towards unscientific, or what I believe is an unscientific approach to gathering data?
I just think that this was so irresponsible of the authors. And like, these are people who are, well known in our society. I feel like I want to say were well respected. This comes out of MD Anderson. Why wasn't this published in our own journal? Why are they using like patient self-reporting and like 20% of patients actually answered the questionnaire? I mean, it's not randomized, it's not prospective. They have men included in this against the general population. I mean, it just doesn't make any sense.
Yeah, Dustin, what's your take on this?
I 100% agree with Dr. Gordon that it was an irresponsible paper, the way it was published. It's bad data gathering, it's bad data analysis, and it has the feeling of sensationalism, and it's frustrating coming from our own colleagues.
And I think it's important to note that, this comes from a group that basically their whole practice is non-implant based breast reconstruction. So is this being financially motivated? Like, what's going on here?
Yeah. Luis, do we need to be talking to the editors of these journals to talk about responsible journalism, to make sure that papers are appropriately vetted so we don't frighten patients with poorly conceived and poorly reported data?
I just see this time after time with studies, with sensational nature and content, and I think it's a good point. I don't know how you would actually do that. The only way that I can see doing that is just if there's something like this that's done, then we've got to go and we have to be responsible as board certified plastic surgeons and do a really good study just to make sure, because we're all about patient safety. I think that's the way we're going to have to handle it. I'm not sure how we're going to actually get editors to listen to us, but if issues come up like this, I think we need to first take patient safety into account. Second, look at the study, and if we think it's a faulty study, then design some of our own more responsible, really looking at the problem and trying to get the real research out there.
Well, we should be able to do that, right? We should be able to design a study, and now we can measure all these inflammatory markers, which they didn't do in this study. There's no markers at all. Why can't we look at markers for inflammation and get them pre-op, and then get them maybe like a week post-op, 3 months post-op, 6 months? I don't know. I haven't thought it all the way through.
The study design is there, though,
but I think that it's definitely there. And they didn't look at any markers in this study. This incidence with melanoma, I mean, it could just be that women feel great in their bathing suit now, so they're sunbathing more, so they have more sun exposure, so they have more melanoma. Causality and association are not the same thing. I think Dr. Reed has
The analogy I always use for patients when I'm describing how research works is that if you look at the numbers, then you could come up with the idea that ice cream causes rape, because the rates of ice cream sales go up in July and the incidence of rape goes up. But we all know that that's not what it is. It's warm weather, people are out. There's no causality there.
Well, I think there's been a huge number of studies that have done just that, and they're much better designed. The problem here is that the study is designed so poorly that it's meaningless, which is true, incidentally, about a lot of studies out there. If it's not constructed well, you might as well just read a story in the National Enquirer, because not to disrespect the National Enquirer, but maybe it does a more truthful job than that.
Yeah, in short, there are hundreds of thousands of women who have successfully undergone breast reconstruction and breast augmentation who are not having issues like this. And a small number of people who feel that there may be an association has created this great kerfuffle, and a lot of women are frightened. And I think it's very important for us to be responsible, try to allay that fear, and absolutely be sure that what we're doing as plastic surgeons is safe. Any further comments?
Well, I think we should ask female plastic surgeons. I think the majority of female plastic surgeons have breast implants, and we obviously feel that they're safe. They're in our own body. I would say, a lot of the male plastic surgeons, their wives have implants, their daughters might have implants, their sisters. And obviously, we would never do anything to put our patients at risk because patient safety is number one.
Well, thanks for listening. For more information, go to theplasticsurgerychannel.com.